biggest myth which I come across is that dark skin people don't require sunscreen. People with darker skin do not get sunburn, but
Right.
definitely they'll get tanning, they'll get pigmentation, they'll get UV burns, UV radiation, and even up to skin carcinoma.
So whether it's a sunny day or
A
in the
cloudy day.
house, it
Yeah,
doesn't
you have
matter.
to wear sunscreen. I don't want to name the brands, but even if you talk about the biggest brands, they don't have license to put everything. So if we compare a La Mer 35,000 or 40,000 cream to a 300, 400 cream, which is made by a proper licensed company like Glenmark or Cipla, is more beneficial for the patient than using that cream. A smaller company, a licensed company, will invest money in research and development about knowing more and more about the product. While the expensive and the big companies will spend the money in advertisement. Use a sunscreen, but make sure whenever you are picking a sunscreen, it should be broad spectrum. We only end up seeing UVB, that UVB SPF 50 or this and SPF is sun protection factor. That is, we are talking only about UVB. There are multiple rays. So when we talk about broad spectrum, it's covering all the rays which are affecting your skin. Some people who drinks excessive water, that can also be bad for you. Around 90 to 95% of the patients come when they have pigmentation. Post their picture with acne. Make this a trend. Don't do DIYs.
Welcome to Pragya. Today, we are covering the largest organ in our body. The body is the same for us all, the man, a woman, a child, and an elderly person. Age happens to everyone. The important thing about birth is knowing exactly that one day you will pass on. Having said that, we have got you the top dermatologist, cosmetologist from Delhi, who is just not an achiever, but is also a meditator, believes in different ethoses in life, a complete father, a complete doctor, and a complete being who believes in the truth of life, is also on the journey of helping humanity. Today, Dr. Amit Bhasin has taken time off from his work to spend hours educating children, people sitting at home, for their skin, for what is really a myth and what is the truth about your largest organ in your body, which is your skin.
Thank you so much for such a beautiful introduction. And are you looking stunning as always?
Thank you.
And your skin is glowing.
Thank you to you.
Yes, thank you so much
So,
for the
doctor,
beautiful, beautiful introduction.
doctor, please introduce yourself.
Hi, I'm a dermatologist and cosmetologist. I'm practicing from last 20 years. It's been 2 decades, and I'm loving this field. I'm from a family there where there are 26 doctors around the globe,
Wow,
and
how wonderful
in
is
our
that?
family, we run one of the biggest hospital as well, which is called Royal Hayat. It's one of the biggest hospital in Middle East. Yes, from our four generation, we have been in the same field, so I guess it's contagious, and I feel proud that I'm born in this family, and I'm taking this contagious thing to the next generation. My niece is also becoming doctor. She's studying from Ireland, which is one of the biggest university in Europe. And yeah, I feel very proud and that I am in the field to serve humanity. And plus, it's slightly glamorous also.
So, like I said, the doctor is very humble. He's talking about his cousin, but he's not telling us about his awards. So, my question to you
Yes.
is, what are the awards you have received?
I have actually, I'm the only dermatologist from a country who's gone to Johns Hopkins in the field of dermatology under scholarship. And for that, I've received multiple national award, Indian Achievement, Indian Icon, Bharat Samman, and Rajiv Gandhi Award, Rajiv Gandhi Excellence Award. These are just few names. And yeah, I feel very proud and amazing that I went to Johns Hopkins and I learned a lot and I got all the knowledge and information back to our country, and it feels amazing.
It's amazing when you hear the word back to our country. So,
Yes,
let's take the information just not to our country,
yes,
but to the world.
yes.
The world, which is just so caught up in cosmetic stores,
Hmm.
children completely unaware of what is really good for their skin.
Hmm.
It's a digital world. We understand it at Pragya. I'm sure you understand it as
Hmm.
well. And at Pragya, we believe in authenticity, and that's the reason why we have you with us today. And
Yeah.
thank you for your time. But what we want to bring out is the fact that you don't buy supermarket products from a fashion boutique.
Yes.
So it's extremely important, and we take it as our responsibility to the society to bring out the myths that are there regarding skin,
Mm-hmm.
where children can benefit, where
Mm-hmm.
women can benefit,
Mm-hmm.
where men going to work can
Mm-hmm.
benefit,
Mm-hmm.
even in the shortest time in
Mm-hmm.
their daily routine. So,
Yes.
may I ask you to unleash the
Mm.
myths that are there about skin?
Yes, sure. One of the biggest myth which I come across is that dark skinned people don't require sunscreen. This is one of the biggest myth. Everybody requires and need to apply sunscreen properly. Dark people, people with darker skin, do not get sunburn, but
Right.
definitely they'll get tanning, they'll get pigmentation, they'll get UV burns, UV radiation, and even up to skin carcinoma.
Okay.
So it's not very common, but it can be seen in darker patients. So darker patient, yes, has to apply sunscreen. Very important. Second myth would be that Ayurvedic, or I'm just saying that like natural and organic product are all safe. You
Okay.
have to use, even if you're using natural or organic product, you have to use under guidance. And as you mentioned, people are buying everything. There are many influencers who are not professionals, they are just influencers. Suppose if XYZ, who has zero knowledge about anything about skin and have multiple followers,
Right.
X number of followers, so suddenly he comes in the category of influencer, and whatever he's saying, even with the lack of knowledge, people are following him. So that is something very wrong, and that should not happen.
So basically, it's like an advertising. A person who has influence
Yes.
over other minds should definitely take up to their responsibility as a citizen of
Mhm.
whichever part of the world they are from. But having said that, we are the ones to self understand that we are getting influenced by what they're showing us. Your true knowledge of your skin is not from an influencer, it is from a doctor.
Yes, a professional person who is a dermatologist or a cosmetologist or have spent a lot of time in the field of dermatology and cosmetology.
Right.
Knowing even a trained nurse can guide you, but not an influencer, for
Not an
sure.
influencer.
Yes.
So, guys, just be careful why you buy the cream or why you buy the makeup. And is it the influencer or is it a doctor? Doctor, what are the other myths about skin?
So I'll come related to this only, myth number three, which is expensive products are good.
Okay.
Not all expensive, like I don't want to name the brands, but even if you talk about the biggest brands, like if I may name like La Mer or La Pre,
Okay.
they don't have license to put everything. So if we compare a La Mer 35,000 or 40,000 cream to a 300, 400 cream, which is made by a proper licensed company like Glenmark or Cipla, is more beneficial for the patient than using that cream.
So, myth about expensive versus
Mm.
something which is more dermatology
Yes.
and
Yeah.
is a pharmaceutical company for the skin.
Yes.
Okay.
And why they are, see, a smaller company, a licensed company, will invest money in research and development
Right.
about knowing more and more about the product, while the expensive and the big companies will spend the money in advertisement,
Advertisement and packaging, perhaps, because
packaging.
sometimes it's
Yeah,
really attractive when you're passing through duty
definitely.
frees and you're passing through a store which has got all these brands,
Yes.
and it's all fantastically displayed, etc.
Yes,
So
yes, definitely.
so it's not in the package, it's in the product.
Product, definitely. But definitely because of so many attractive packaging, even when I go travel anywhere, I get attracted towards beautiful packaging. I don't even see what the ingredients are.
Right.
Nobody reads the ingredient. Oh, this packaging is looking wow. It will be amazing for the skin. This is how we relate.
Okay, so
Yes.
it's a complete understanding of your own self
Hmm.
and your own consciousness, that you, by just buying expensive stuff, doesn't mean that you're doing good to your skin, good to yourself, and of course not doing good to your budgets as well.
Yes.
So what's the fifth myth?
That anti-aging is only for certain age because we end up thinking that anti-aging treatments or creams are only for when you are in late 40s or
Yeah, I would
50s.
think that as well.
No, because even this time when I went to Korea, the main focus was on prevention and
Okay.
how early education, how starting. I'll give you one example. In India, you see lots of ladies with pigmentation
Right.
because even in my practice, around 90 to 95% of the patients come when they have pigmentation and in the stage 2 or stage 3. They never come for
So
prevention. No lady will
prevention is
come
better
in
than
20s.
cure.
Definitely,
Prevention is better than cure,
definitely.
and we should look at our skin as a preventive
Yeah,
from pigmentation
on
and
any
aging.
point anti-aging because at 20s late 20s there is the depletion of collagen and as well as your natural hyaluronic acid which is a natural sugar present in the
Funny
body.
enough, in the world also, when you look at a magazine, you look at anti-aging creams and product, and you see an elderly model. So let's just come off the myth. Prevention is better than cure, and also the fact that in your 40s, if you're hoping to now start the journey of anti-aging, it's rather too late because you've already depleted certain hormones, certain juices in your skin. Doctor, but last but not the least, what's the magic myth that you're going to share with
So I
us?
have talked a lot in the field of dermatology. I want to talk one myth in the field of cosmetology,
Okay.
and it's a very important thing because people are scared of injectables because they think fillers can freeze your face, freeze your expressions, give you that frozen look, and a filler can make you look unnatural. Fillers are only for girls. It's not true. I'll give you one example. Like a small child is scribbling with the pen, and an artist with the same pen or pencil shows his magic.
Right.
So it's not the fault of the pen. It's the reason what happens. Girls or boys, they shop. They go and find out the price, and they find, oh, this clinic is giving better price. Let's get filler from there. It's the skilled job. You have to look for an artist. It's not even the knowledge. It's an amalgamation of your knowledge and your skilled art. That
And
how much a sculptor are you to give that look. And the reason why we are scared because we see many celebrities whose work is overdone. We don't want to overdo, but definitely, and fillers never freezes your expression. It's entirely a different treatment, which is called botulinum toxin, which freezes because it is paralyzing that muscle.
so basically, all these things were used and created for uh, purpose of surgeries and people who are suffering from acute conditions.
Yes, so I'll tell you that there have been many cases you see patients who are paralyzed or there is asymmetry since they are born. And
Okay.
we use this hyaluronic acid, which is naturally present in your body, and
Okay.
we are reintroducing in your body and just giving them that pleasure. Because there was one girl who came to me whose eyebrows has was dropped since she was born. She was 25, she was about to get married, and she was so conscious, and when I fixed her eyebrows with hyaluronic acid and the way she hugged me and she started crying. So it's not only that aesthetic part, it's definitely aesthetics, but the way you are correcting some deformities or fixing some asymmetry can give you such a pleasure.
So fillers are not all bad, and
Yes.
the doctor said it's like almost like an artist's job. So you can't compare price worth with quality. So be aware that yes, it's not there to freeze your face. That's a myth that's taken off. Anything which you want to get done to your face for enhancing of your looks, then it is with a cosmetologist. So two different fields altogether. Here, Dr. Basim is a cosmetologist, a dermatologist, and he specializes in giving a non surgical facelift.
Yes. Yes.
Okay. Sometimes, once we go on this road of fillers,
Yes.
that there is no stopping.
No, not true, not true at all.
Okay.
So these all these treatments are temporary. They stay in your body from 6 months, lasting to 24 months. So for half year to 2 years, and then they're gone. So there are many patients or many girls who opt during their the biggest day, the day, the wedding day, they want to get something fixed, and they don't come back for doing that again.
So it's not about once you start on the
No,
road, then
no,
you have to
never.
keep
Yeah,
getting it done.
it's your choice. Whenever you want to stop, you can stop.
Okay. And
But definitely that effect will go.
okay.
But definitely,
Yeah.
yeah,
But it's not like you have to freeze your face completely to get
not at
the
all,
thing.
not at
And,
all,
and
not
because
at
we
all.
have a lot of these film stars that we see and celebrities,
Yeah.
they have a completely frozen face. And
Yeah, that's not because of fillers. That's because of Botox. Botox is the brand name, but it's
okay.
a toxin produced by Clostridium. It's a
Okay.
bacteria which is called Clostridium bacterium. It produces a toxin that paralyzes the muscle. So these are like the nerve ending which are taking the signal from the brain and sending to the muscle to contract, to raise, or to elevate. So the connection between the two nerves is stopped with this
Wow.
toxin. So that's
Okay.
why the movement of the muscle is reduced. That's why we don't see line. See, the line comes whenever the muscle are contracted. See, when you raise
Yeah.
your eyebrows, you see the lines.
Yeah.
And lines are perpendicular to the direction of the muscle.
Okay.
This is also another fact.
So,
So that once the contraction stops, the lines goes away.
so,
So
doctor, you're just not good looking, but you're superbly clear with your information, and thus the awards, thus the recognition.
and that's
So,
sitting next to you.
superb.
Yes.
Doctor, tell me, children.
Yes.
Doctor, tell me, what are the most common features
Hmm.
children are facing when it comes down to their skin?
Mhm.
And what are the basics of the problems that commonly people come to you with?
So the most common problem, top five, I would say, the top one would be acne.
Okay.
Then it's oily skin. Then it's enlarged pores, hair loss, pigmentation, scarring,
Wow.
and keratosis pilaris, fungal infection, folliculitis, warts. These are the top 10 most common conditions I'm seeing.
And is it in children or is it across the age group?
So, if we see very young kids, I see people with melia and warts at a very young age from 1 year to, let's say, 90 years.
Really?
Yes, which is a viral infection
Okay.
and fungal infection and dermatitis. These are even seen in very younger patients. If we talk about teenage, we see a hair loss, which is starting at a very early age.
Is it 10, 11, 12, 13 now?
So
Because,
I
with
have
the
seen
hormones
as
changing
early
now,
as 9 and 8
9.
also,
Okay.
where they see massive hair loss. But a typical androgenic alopecia, which is male pattern baldness, which I see in late teenage.
Okay.
Yeah, like 1920 when they start facing this.
So, if there was a child who was watching this today,
Hmm.
if there was an adult, they don't know who to ask, what to ask, and they're seeing all these products that if you use this moisturizer or if you use this face wash, your acne will go away. You are your if you put this hair oil or this serum, you will get hair growth. And I feel that's just misleading children, and that is the future of our world and tomorrow.
Hmm.
The consciousness of their being and the way they are looking
Hmm.
is not just a short term thing. They're creating the neurowebs of their brain at a very young age. And that fear of rejection
Hmm.
can be extremely long lasting.
Hmm.
So at Pragya, we are very clear we're going to come up with solutions
Hmm.
from the help of doctors
Hmm.
and scientists
Hmm.
and, of course, spiritual masters about all these myths. So if there was a child who
Hmm.
was watching this show today
Yeah,
who is becoming a new adult
yeah.
or the next adult,
Hmm.
what is your advice for acne for them?
First advice is stop believing and doing this online shopping.
Okay.
Don't follow influencer for the guidance where you need a professional person. They're
So a
not
doctor
professional.
would be a professional
A
person in
doctor,
this
as I
for
mentioned,
acne
a
especially.
dermatologist, cosmetologist, or even a nurse or a physician. They
Okay.
can give you right direction. Second, whenever even I'm seeing a patient, first thing, even before handing out the prescription, I do 10 minutes of counseling, not only to the child, but also to the parents, that this having acne is absolutely normal thing. And it will happen to most of the people.
So it's a very natural phenomena of the body. Acne is not a problem. Acne has a solution, and your solution is with a doctor.
Yes, and acne, the most common acne, which is called acne vulgaris, the most common area is face, upper chest, shoulder, back. This happens to almost everybody, but at a different age group. So normally, what happens, like kids coming to me, I have acne, and my classmate doesn't have, so they end up peeling and pricking them.
Oh my God.
Yeah, because they suddenly see the pustules, the pus-filled lesions on their face, and they find it eek or yuck, and
Right.
they have to just peel it, prick it. This became a trend also in 2018, acne popping trend. So
Okay.
which is the cause of scarring. So this is what social media is making a trend, making everyone cause acne. And acne is not as easy to tackle as acne is. Acne still will take 3 to 4 months, but acne scar can take 3 to 4 years to
Wow.
completely treat them. And still we don't give 100% results.
So it's still, once again, is prevention better than cure from a
Prevention and
doctor?
counseling is very important, that this is parents have to tell that this is absolutely normal. Teachers have to tell that this is absolutely normal. They have to post their picture with acne, make
Okay.
this a trend. So rather than pricking and peeling and following the consequence of scars and pigmentation, PIH, the different scars which they get, ice pick, rolling, box scar. And then that initial little period of when they're feeling little, they're getting conscious because they are not properly counseled.
Right.
Rather, later they are with scar for their life.
So doctor is saying that, okay, firstly, even for parents, you got to be aware that this is a natural phenomena. So please don't judge your children. In fact, be supportive to them, counsel them, because these are not scars that will just come on the skin, but they will also come on the soul and the heart. And doctor, my next question is that uh, how early does acne go away? Is it like a 1 day treatment, or is it just last for months
Mm.
or weeks? So what is it?
It's a very valid question, and see, different patient reacts and respond differently to the medicine. So on an average, we say 3 to 6 months you have to give. You have to counsel this also, because every patient who's coming, they think that in 15 days their skin will be clear, and they compare, my friend went to X doctor, Y doctor, in 15 days it was clear. You're not a good doctor. So there should not be any timeline, because it's a whole, as you mentioned, as you started, skin is the largest organ of the body, and we have to give time. We have to be patient with the treatment.
And the fact is that you have to understand it's really a treatment. It is not a 1 day thing, and it's your own body, your own repair system. What are you eating? What are you doing? Are you exercising? Because that also impacts the
Yes,
skin, right?
definitely,
And stress also, I believe,
definitely.
impacts
Yes,
the
yes,
skin. And
yes,
children are going through such a competitive time now, and especially in a digital world.
yes.
So does that make a difference on their
Definitely,
skin condition
definitely,
as well?
because of their lifestyle, we are seeing this. So, when we're talking about hair loss and acne, it's not only because of their particular age, it's coming younger and younger because of their lifestyle. Too much exposure to the light, too much what they're eating, they're not taking care of their diet, they don't take care of their gut, they don't know about the
So
bacteria.
gluten would impact your skin?
Only if you are gluten intolerant.
Okay,
Yeah. So, you
right.
have to
And
know
dairy, what about
if you
dairy?
are lactose intolerant.
Okay, so otherwise it's not I mean, it may or may not. And that's where you would come to a doctor, and that's where you would
You
get
have
a
to understand,
nutritional
yes.
check about your blood,
Yeah,
etc., etc.
yeah.
Yeah. But these things do impact the body.
Like, for instance, even in my family, one of my sister is lactose
Right.
intolerant, and I can not live without desi ghee and milk,
Okay.
because that is a very important thing for my skin.
Okay.
Yeah. So
Okay.
it's what's suiting you and what's not suiting you.
So it's not like everything, one thing is good for everyone. So have this myth also clear that some people are dairy intolerant, some people are gluten intolerant. So this is not across the board thing, because, and also with parents, with elderly parents, they constantly say that hum to we eat wheat, so what is your problem with wheat? And how would that impact your skin? Well, the truth is that we're all different. Two leaves are not alike. So, two points are not alike. Two children are not alike. And their problems and their situation and way to deal with their issues is not alike. So, please consult a doctor, get the right treatment, be patient, be consistent, because it's really something that will go a long way, just in not in your skin, but also the way you think and the way you feel. Doctor, tell me, what are the kinds of acne? Is it just one kind, or are there several kinds of acne? And do uh, skin types matter? Like dry skin, do they get acne?
Mm.
And finally, give us a solution for acne.
Okay, so there are multiple kinds of acne. So today we are talking, when we're talking about teenage, the most common type of acne, that is acne vulgaris, we are
Okay.
talking. And even in acne vulgaris, there are multiple grades. Grade 1, which is non-inflammatory, where there's no inflammatory lesions, which are comedons, which are closed comedons and open comedons. In layman language, we call it a blackhead and whitehead.
Okay.
Next stage is papule, where we see those pimples,
The red,
acne,
the
the
marks
red
and the
ones.
pus and
No,
stuff in
not
it.
the mark is the consequence. So
Oh,
it's the red inflamed lesion,
okay.
which are called pimples.
Okay.
And then grade 3, when we see a lot of pustules, pus-filled lesions, the
Okay.
white
Okay.
lesions, not the red one, the white ones. And grade 4, when there is cyst and nodules and deep scarring that is happening. So scarring and pigmentation is the consequence of acne, taking wrong treatment, and what patients are doing under stress without
Oh
guidance
my
when they're
God.
pricking and peeling.
I didn't
If they
even know.
don't prick and peel, we won't see the scarring.
I cannot believe what you've just told me, because
I am the
I
person
thought,
who had severe grade 3, grade 4 acne,
and
but I was treated properly. That's why you
beautiful,
don't see any
any
marks.
marks at all.
Yes.
So basically, it's about your treatment of the acne.
Mhm.
And of course, it depends on your stage of it. And
Yes.
most of all, it's the fact that we cannot give up on it.
Yes, yes.
Okay.
And your other question, does this is a very common question, because even when people with dry skin come and I say it's acne, they say I can't have acne. This is dry skin. I have dry skin. So dry skin can also have acne.
Right.
It's a very common thing. And why it happens? Because when your skin is dry, your body has a compensation mechanism when it's producing more sebum to
Okay.
compensate. So that's why you end up having inflammatory acne. And why inflammatory? Because your barrier gets affected.
Okay.
Yeah. And your pores get clogged with more and more dead tissue.
And what you just said, that we can actually repair this acne.
Yes, we can repair
It
this
is
acne.
repairable,
Yeah,
and
yeah.
it has.
Every grade, every stage can be taken care with a set of treatments, with some guidance, with some dietary changes, and proper prescription, proper
Amazing.
regime.
I believe there are creams and face washes
Mhm.
that actually help us in getting rid of it.
Yes.
But a child does not know
Mhm.
what is a branded one, what is a marketed one, what is an influencer product, or what is the real product.
Yes.
So, where should they get the real product
Mhm.
from, and what does the real product look like?
Yes. So the best thing for that is to show to a professional dermatologist. But definitely there are many people who can't go and visit to a dermatologist. I want to give few tips and solution. First, do not prick or peel or touch acne. Get proper medicated creams. Like clindamycin is one of the antibiotic commonly used, and it's you can easily get it at any pharmacy.
Pharmacy.
You can apply that. Use a cleanser that is very gentle to the skin.
Okay, is it
Yeah.
a pharmaceutical cleanser or is it a
Can I
cosmetic
name
cleanser?
some
Yes,
brands?
of course, that'll be
Like
lovely.
Episoft and Cetaphil are very good brands. And CeraVe, you can use those cleansers. They are very gentle to the skin. Use a moisturizer. There's a misconception again where people think oily skin cannot use moisturizer. Definitely, they can use a moisturizer. Mo- See, your skin is oily because there is excessive sebum production.
Okay,
But we are using moisturizer to hydrate the skin. Both have different purposes. So you
okay.
have to remove excessive oil production, dirt, and dead skin. But at the same time, you have to hydrate the skin.
So
So a
washing the face,
moisturizer, washing is important.
okay,
For mostly dry skin, use a gentle cleanser. If you have normal to oily skin, use a cleanser with salicylic acid. It's easily available. You can use a good brand. Cipla, Glenmark, these are good brands. You can buy a salicylic or glycolic acid based cleanser. After that, use a moisturizer. Moisturizer is must not only for dry skin but for oily skin as well. Use a sunscreen, but make sure whenever you are picking a sunscreen, it should be broad spectrum. We only end up seeing UVB, that UVB SPF 50 or this and
So
that.
again, that's a myth, right? I mean,
See, SPF is sun protection factor. That is, we are talking only about UVB. There are
right.
multiple rays. So when we talk about broad spectrum, it's covering all the rays which are affecting your skin.
So whether it's a sunny day or a
A
in the
cloudy day,
house, it
yeah,
doesn't
you have
matter.
to wear sunscreen.
So because they are rays that are
Yes, yes.
in the place that we are is it's the light in the house, it's light of
Gadgets,
gadgets
yes.
and the phones, etc. So sunblock is a must use for every day,
Everybody,
whether it's a sunny day or a cloudy day.
yes,
That does not affect your usage of your sunblock, and
yes.
in that, please look at a broad
Broad
spectrum.
spectrum, yes.
Broad spectrum. And should it be pharmaceutical or should it be a cosmetic brand? Because I see
There
a lot
are,
of cosmetic brands
yes.
doing sunblocks. What's your
See,
suggestion?
again, it depends on your skin type.
Right.
There are people with sensitive skin, they cannot pick any brand. But people with normal skin, they can go for any brand. There are good brands which are not pharmaceutical. They're also producing good sunscreens, and you
Amazing.
can do it.
Okay.
Yeah, I don't mind. But doing home-based treatment is not what I recommend.
Okay.
Sunscreen you can, but definitely you can't. I don't know whether I can name what not to use.
Okay. Why not?
I'll give
Eh,
one of the example because people coming to my clinic and saying they're using Lotus sunscreen. So definitely a no-no for that.
Okay.
Yeah. So, and for the girls using makeup, make sure they're using a primer. They're
Okay.
using primer before applying concealer or foundation. Primer is a layer which is a layer between the skin and the makeup. So it's a must. And whenever you are buying foundation or concealer, you have to read a word non-comedogenic. Even for the sunscreen, you have to make sure that the sunscreen has this term non-comedogenic.
What does that term mean, doctor?
Non-comedogenic. Comedogen is the first stage of acne. So non-comedogen means that it won't clog the pores and cause acne. Is
Okay.
the first stage. So let's suppose this is one hair follicle. Every hair follicle has a gland, a
Okay.
small gland here called sebaceous gland that is producing sebum
Okay.
to control the body temperature and doing different functions. So whenever there is hormonal change, the gland gets very activated and there is excessive sebum production,
Okay.
and then the pores get clogged. And
Okay.
that's how the acne's first stage comedon comes. And that's why it's called closed comedon or whitehead.
Okay.
And once it opens, it gets oxidative
Okay.
and the color change into black. That's
Okay.
why it's called blackhead.
Okay.
So any product that is causing these lesions, they are ultimately going to cause acne. So
Okay.
you always have to make sure to read non-comedogenic.
And doctor, I hear a lot about makeup
Yeah,
being toxic,
yeah.
because when we can, and when we put a nice moisturizer
Hmm.
and cleanse our face, it
Hmm.
gets absorbed into our
Yes,
skin.
yes, yes, for
So
sure.
does makeup also get absorbed into the skin? Because I see a lot of these young kids buying a lot of lip glosses, and at a very young
Hmm.
age of 12 or 13
Hmm.
starting to put makeup on.
Yeah.
Could this be cancerous in the future, because makeup, which is from different brands
Hmm.
and has, really no research done on itself,
Yeah.
and we're just buying it because influencers are
Yeah.
using it, we hear it, it's a very well marketed product,
Hmm.
and then we see everybody beautiful with a makeup in a makeup ad.
Hmm.
So is this something that we should be considering for the better health, and of course, to be cancer free?
100%. There are many ingredients in makeup. There are scientific paper which shows those are carcinogenic and causing different skin condition, aggravating eczema, clogging the pores, even causing acne, pigmentation, scarring. So we have to, the only solution is don't trust the influencers, trust professional people. There are good makeup. Always use a primer before using makeup and make sure to use non-comedogenic makeup and from a trusted company which
Okay.
has done good amount of R&D, research and development.
Okay, doctor. I'd like to know what are the new innovations that you'd like our viewers to know in cosmetology and dermatology.
Okay, so I'll talk about the top five. Number one would be mesenchymal cell drips. These are the cell derived from umbilical cord and without causing harm to the mother. And this is something which we discard after the birth of the child. So this is helpful for the mother as well. She can do cell banking, and as well as these cells are using in the field of anti-aging
Wow.
and cosmetology. Number two would be exosomes. Number three would be where we are using salmon fish's sperm's DNA, which matches our DNA. And we are using those tiny injections. We are using a needle 34, which is painless. And we are using for the generation for production of collagen, production of elastin, and production of a better skin, which improves the texture of the skin, tone of the skin, even it makes the skin more tighter.
Okay.
So this is a very exciting thing, and this is what is known in Korea as Korean glass skin.
Okay,
Yeah.
everybody's talking about it.
Yes.
I'm sure you've read magazines. I've read magazine,
Yeah.
Instagrams, and Facebook. Everybody's talking about the Korean skin, and this is what is actually
Yes.
enhancing it. Amazing.
There are two more which are going to be a huge thing in the coming future. One is AI in dermatology and cosmetology, and one is gene mapping.
Gene mapping and AI in
Yeah, we are using
cosmetology. How is that going to happen?
artificial intelligence in the remote area for diagnosis where patient cannot go to the doctor.
Wow.
And if we talk about gene mapping, so gene mapping has already been start in 8 different countries.
Right.
It's in America, in Europe, it's in Switzerland, in Asia, it's in Japan, Singapore, Korea, and China. And we see these are the centers which are mapping the gene, and they, instead of treating the symptoms, they are going to treat the root cause.
Wow.
What
And
Pragya
what
is
do you
doing.
think? Thank you. Thank you,
Yeah.
doctor. And there could be several root causes to these conditions that
Yes, yes.
it's going to be
Yeah.
perhaps looked at in the future.
Yeah.
Doctor, what is, if there was three things that you're going to tell someone that, okay, for your good skin and, an ageless skin, of course, we all have to age, but something that is still nourishing because this is how you're going to look and this is how you're going to come across. What are the three tips you're going to say? Just three
Use
lines.
a milder cleanser.
Milder cleanser.
Moisturizer is a must.
Okay.
And sunscreen,
Once
the
again, it's the
most important thing.
Okay.
Yes, yes.
So you've got three tips again from the doctor.
Yes.
This is your lucky podcast. Doctor, tell
Yeah.
me, at a woman or a man coming to you at 50,
Mhm,
or this whole thing about the puffed up lips,
mhm,
proper
mhm,
jawline, and lots of fillers,
mhm.
and trying to look 20 years old.
Yeah.
So, what is it as a doctor
Mhm.
when someone comes to you at 50 and says that, I really want to look young, I want to look like I was 20? What's your advice to them?
Beautiful question, and I love this question because recently, 2 months back, I went to Seoul, Korea, for one of the world's biggest conference held, and the main topic of discussion was this: where the people and doctors and scientists from around the globe were coming and talking about not to change the feature of the patient. This is the worst thing any doctor can do. And even patients, because of social media awareness, they are aware. They don't want, a 50-year-old doesn't want to look 20, but she wants to look the most beautiful person.
Of
She wants
herself?
to look the best version of herself.
And what about men?
Men also, these days, post COVID, earlier, if I tell you the ratio before COVID, I used to see 10% guys and 90% girls. Now it's 70% guys and 30% girls.
Wow. So the men are right there getting their
Yeah, why
act
not?
together too.
Because everybody has realized
Yes.
this is what is going to represent you. No car, no bag, no house. You'll be taking everywhere to show that.
Right.
This is you can show. And definitely, it's not only about cosmetics, it's about your sleep, your happiness, your brain. Everything reflects on your skin.
Amazing. And does
That's what
water
God
help
has.
us?
Yes, definitely.
So, right amount of water as
Right
well?
amount of water.
So,
But let me tell you, I see many patients also who are overhydrated.
okay.
That is also a condition which is very bad. Some people who drinks excessive water, that can also be bad for you.
Okay. So,
Yeah.
there's lots that we have learned today. And with doctor, one thing that came very clear, that it's not the marketed product that you're going to be seeing. It's not the advertised product which you're going to be seeing in counters and in magazines or through influencers or through marketing. It is actually got to be a doctor guiding you,
Mhm.
something which everybody is going to see. You're not going to be, like he said, you're not going to be, your bag is still in your arm, but your face is a representative of who you are, what you eat, what you think, and how you take care of it. So instead of wasting thousands of rupees or hundreds of dollars using a product which is actually not what your desire is. Your desire is to ensure that your skin is good, your skin is hydrated, you are protecting it from sun damage. Then go to a doctor, get your prescription, do your checkups regularly, be committed, be consistent. Pimples happen to everyone. Don't feel depressed about it. It is just a part of growing up. The point is not to break them. The point is not to lose hope in them. The point is not to give up on yourself. Go to a doctor, get the right treatment, and take care of yourself. Thank you, doctor. Thank
Wow.
you, Dr. Aarti
Beautifully, you
Bhasin.
have concluded the whole interview.
Thank you, doctor.
Yes.
Thank you.
Thank you so much.
How was
Thank
it?
you.